So greetings everyone and welcome to the 91st session of the online Optom learning series, and wishing everyone a very happy new year 2021. I hope this year is going to be hopefully much more better than what we expect. Let me go ahead and introduce to all of you our speaker for today. Today we have Mr. Effendy Bin Hashim. He is an optometrist from Malaysia. He's actually the chief optometrist at the Penang General Hospital, Malaysia. He also currently holds the post of second secretary to the Ministry of Health Subcommittee on Prevention of Blindness and Cataract Services, monitoring for the year 2020 to 2023. He also is the vice president of the Association of Malaysian Optometrists, the Penang chapter. Mr. Hashim graduated with Bachelor's of Optometry from the National University of Malaysia way back in 2001, and his career as an optometrist started in a retail store first for about 2 years. In 2004, he then joined Malaysia's Ministry of Health, working as the Assistant Secretary to the Malaysian Optical Council, which regulates the profession in the country. As an optometry officer with the MOH, he was posted to several hospitals within Malaysia. He is a keynote in terms of public sector, so he is serving the public sector during all of these experience here, and he has also managed to secure an additional degree in Bachelor's of Law from the University of London through long distance learning program at 2015. He was also one of the instrumental person in data collection of the Malaysia's second National Eye Survey 2014, where he went house to house looking for subjects aged 50 years and above to conduct some simple eye test following the WHO recommended rapid assessment of avoidable blindness, or otherwise known as RAP protocol. He is a firm advocate for the prevention of blindness and is also a founding fellow in public health for Academy of Optometry Malaysia. So I welcome Mr. Effendy onto our platform, and today he is going to take us through the role of optometrists in the prevention of blindness. So thank you very much, sir, for giving us your time on the first session of our new year. Let me just leave the screen time to you now.
Okay. So thank you very much, Mr. Fakhruddin, for very kind introduction. And I'm here, would like to wish every one of you a happy new year 2021, and hope that I could deliver whatever topics that have been entrusted to me as simple and as general as I could, so that we just take things easy. And first thing first, I guess there'll be a poll during our session here. Fakhruddin would like to probably start our poll. If everyone, majority are from India and also Malaysia too.
Yes.
Yeah.
India, Malaysia, and a couple of them from Pakistan, Mexico. So sorry, I didn't have many options to put up on the chat again. Apologies for that. We just put up the common. But thank you for putting up on the chat and letting us know where you are from. So excited, and thank you for being a part of this.
Yes, thank you very much, everyone. So I try to be as brief as possible, and I understand that half of us are optometry students, and then most of the optometrists all from India, right? Almost half, more than half. Yes. Okay, I think we can start looking at our topics tonight. Fakhruddin?
Yes, please.
Yeah. Please. Okay, I'm going to talk about the classification of blindness and vision impairment, as well as the main causes of the global blindness, and about the key concepts of the health system based on the WHO, and also a little bit of universal health coverage, as well as the most important vision report from the WHO. So this is the first slide on the classification. I'm sure every one of us know and understand what is this blindness classification by WHO. And WHO four level of visual acuity are categorized according to number 0 or mild vision impairment or no or normal. It is by measuring the better eye, yeah, worse than 612 or equal to or better than 618. Category 1 will be moderate vision impairment. In this category, vision is worse than 618, but equal to or better than 660. In category 3, there will be blindness. Blindness is been defined by WHO as people or patient who has a vision of worse than 360. And finally, is near vision impairment. People with a vision at N6 or M0.8 at 40 centimeter. And it is also important to recall that the visual status categories are not only based on visual acuity per se, we also look at visual field, where blindness has been defined as a visual field of less than 10 degree from the point of fixation. So this is global blindness and vision impairment. Oh, okay. What can I do? I do not want to share this slide. I want to bring and draw your attention to the most important website, which is IAPB. I hope everyone can see that. Yeah,
Yep, we
IAPB.
can
So
see your.
let's look at IAPB. So the reason why I want to bring your attention to Vision Atlas from IAPB, because this is like really brilliant website that you can have a look at. Everyone can have a, you don't have to wait for my slide. You can just open up. So I'm looking at number 1, magnitude, and perhaps you look at map and overview. Okay, so what can we see here? This is important because according to the Vision Atlas, is a website by IAPB. IAPB is, of course, everyone knew is International Agency of Prevention of Blindness. And you notice that this is very, very important map of our world. And if you want to know where we are now, I believe we are here. And no, India will be South Asia. So if you look at the prevalence is a term used to determine how many people are blind or vision loss here. There are 22.1% of people in South Asia are currently blind. And if you look at here, age standardized prevalence of all vision loss is 14.3%. So you can browse around, play around with this. This is really brilliant, a cool website to go and play around with. And see, 2 GBDs, global, GBD super region like Southeast Asia, East Asia, and Oceania, and South Asia has the highest prevalence of vision loss. And this number 1, if you can open up, that's magnitude. And if you want to look at country also, you can do that as well. GBD region, super region. But I want to bring your attention in inequality. For example, gender. Let's look at gender. So in this website, we can see that there are more females than males with vision loss in every category of vision impairment and blindness. And why is that so? See, 55% of people with vision loss are women and girls. And why women? Why? Okay, you can read that out, but the most important is here. Why do females experience more vision impairment? So, number 1, average life expectancy of women is longer than men. Well, unfortunately, women can also be a greater risk for certain eye conditions. I'm sorry, no, there's no gender bias here. It's just like, in many countries, women actually have less access to eye health services due to various socio-economic and cultural back. So if you look at women and men, most of men in the household will gain access to eye service rather than women. So that's number one in gender. So inequality, if you look at in terms of region, if you can open region here, this is important. 64% of all people with vision loss live in South Asia, Southeast Asia, East Asia, and Oceania. So I've told you, South Asia, 1.8 billion people, 22% of the world population, 30% of world vision loss. Here in Southeast Asia, 2.2 billion people, 30% of world's population, and 34% of world vision loss. So in terms of causes, this is the slide that I supposed to bring, but I want to bring you here because this is the best. We should go back to the what we call the primary source of information from vision atlas, and cataract or uncorrected refractive errors account for most of vision loss. 90% of vision loss can be avoided. I'm sure this is really amazing piece of work by IAPB. I really like this one. You see refractive errors. If you go to that, you can see that moderate to severe, there are 157 million people with refractive errors. But if you look here into cataract, no, refractive errors, 3 million are blind, but moderate to severe is 157 million. It's like a whole bunch of people here. But what about cataract? We know that cataract accounts to the blindness is 17 million. It's even higher than refractive error, but moderate to severe is 83 million. And we also can see that diabetic retinopathy 3 million here, and also glaucoma about 4 million and 3 million. I really like this one. See, refractive error is the largest cause of vision loss, 671 million people in the whole world. And cataract is 100 million people. It's the largest cause of blindness. Again, what is the difference between here, refractive error, and cataract? Because the difference is this is blindness. This is a lot of them in moderate to severe fall into refractive error. What about ARMD? 8.1 million. Glaucoma, 7.8 million. And finally, diabetic retinopathy is 4.4 million. And I guess that's things that I would like to bring to your attention here. So let's go back to my slide. We know that at least, according to the latest statistics, 2.6 billion people have a vision impairment or blindness, of whom at least 1 billion of vision impairment could have been prevented. And we need more reliable data on the met and unmet eye care needs. And obviously, we need planning. Also, the burden of eye care and eye conditions are not borne equally, as I've shown in the Vision Atlas just now. The burden tends to be greater in the low and middle income countries and underserved populations such as women, migrants, indigenous people, person with certain kind of disability, and in rural communities. So population growth and aging, along with behavioral and lifestyle changes, and also urbanization, will dramatically increase the number of people with eye conditions, vision impairment, and blindness in the coming decade. So you can see this, though it's 2017 slide, is more or less, you can notice that blind and moderate to severe vision impairment, the highest percentage is uncorrected refractive error, URE, about close to 50%. But the cataract only 25%. If you look at blind, URE or uncorrected refractive error has dropped to 20%, in contrast to cataract, which is about 34%. We're done with that. Let's move on to my next slide on health system approach, a key concept by the World Health Organization. So what do we understand on about this health system approach? Um, if we ask me what is this all about, this is a cogs in the wheel. You look at there are six different category, or what we call block. According to WHO, is block. And what is this blocks all about? WHO been thinking of how to monitor each country's health system by providing this kind of block where integrating healthcare activities in the health system is obviously important, and where health system itself is how people resource and their actions are organized and promote to maintain and restore health. So a good health systems will provide a day-to-day use, but also planning, and it's a place to anticipate and manage risk, such as natural disasters and epidemic like now, COVID-19. So WHO, these six key blocks are seen, as I mentioned before, as a cogs in a wheel, where we need all to be working together to create a strong health system. So what we do understand in terms of governance, and while I'm explaining this key concept, just bear in mind what this slide is all about. This is about our role. What our optometrist role in terms of all these six blocks. In terms of governance, WHO expected the health system to ensure in terms of leadership, what are the key leader and what are their responsibility in terms of mapping to plan the national setting of targets of all indicators. So that's number one, the green wheel. And number two will be the health personnel. I'm sure we are there where we need to deliver appropriate services, or no, numbers and distribution of health workers and cadres. So we are not the only health personnel in the eye care. There are others like nurses, paramedics, medical assistant, ophthalmic assistant, and of course ophthalmologists and optician. And in terms of service delivery, that's number six actually. And number three will be health financing. Health financing down there, the WHO are looking at how do we finance and manage income and expenditure. And if you look at number four, there will be medicines and technology, whereby ensuring good governance with good information system, that will be on the top right. And finally, WHO expected us to provide equitable, excellent, and economically sound services. So if you look at all these blocks are actually monitoring ways of WHO monitoring us. It will give us a WHO the overall quality of the health system. And my question is to every one of us here, where do we sit? What can we do to help, not WHO, to help our people? Okay, so I guess it leaves us to my next slide.
What comes to your mind when you hear, or if you have any idea, what is universal health coverage? If you can put some thoughts, a couple of words, 2, 3 words on the chat. Somebody says it means equal rights. Okay, that's good. Keep that coming.
Yeah.
Somebody says universal health coverage is the provision of the basic health services at a minimum out of pocket expenses. So that's a huge chunk of idea there. Good.
Yeah.
Thank you so much.
It's good.
Yeah.
Are we waiting for anything more on this poll?
Let's just see. Let's just give them maybe 20 seconds more.
All right.
If you would like to give your thoughts. Equal rights, provision of basic health services at minimum out of pocket expenses. That's the keywords we have.
Yeah.
And we should ensure the availability of services to most of the population. Again, that's one thought coming out there.
Yes, that's good.
Okay, thank
Brilliant.
you so
I
much
mean,
for participated. Yep, we can
yeah.
go ahead.
All right, that's good. So my best term on UHC is this one. No one left. No one is left behind. That's my favorite term. And anyway, in 2015, all United Nations member states have adopted 17 Sustainable Developmental Goals, or SDG, which is to be achieved by 2030. So one of these SDG, number 3, relates to specifically health, and this includes a target to achieve universal health coverage. So UHC means that anyone who needs the healthcare can access quality health services without the risk of financial harm. And UHC aspires to include the world's poor and marginalized in health service improvement so that, as I mentioned before, no one is left behind. So what this universal health means, universal health coverage means, it means that all people have access to the health service when they need it, where, how, and without financial hardship. And those includes all the full range of essential health service, and that's from the health promotion, the prevention, treatment, rehabilitation, and palliative care. So where are the optometrists here? I'm sure you know how to answer that. And currently, you know that about half the people of the world's population still do not have the full coverage of essential health services, and 100 million of them are still being pushed into extreme poverty because they have no money, obviously, to pay for healthcare. And there are about 930 million people spend at least 10% of their household budgets to pay for healthcare. And all of the UN member states have agreed to achieve this UHC as part of their Sustainable Development Goals. So what I would like to highlight on UHC is how important is UHC for us, because in order for us to make a health a reality, we need to empower individuals and communities who have to have this access to quality health services so they can take care of their own health, their families. And the skilled workers like us probably provide a good quality eye care or health care. We need to engage in a people-centered care, and people in the policymaker, like they are, as a policymaker, they need to commit to invest in a universal health coverage, because UHC should be based on the strong people-centered primary health care, and good health systems are rooted in the communities. And because we as a community, we need to empower them, not only by preventing, but we are treating disease and illnesses. Also, we need to improve their well-being, and also finally the quality of life. And well, this is my perhaps final, not final slide, but final topics for tonight. And I'm actually really excited to mention this. I'm not sure whether you guys are aware of this. This is the first ever world report on vision that WHO have published, and I think that recognize and how seriously WHO is now taking on vision. And the significance of this issue is because of what it says. 2.2 billion people worldwide have a vision impairment. And out of those 2.2 billion, 1 billion have vision impairment, and they could have been prevented. And this has yet to be addressed. And obviously, World Report on Vision was published at the end of Vision 2020. And it's also important for us to recognize the success and the achievement that we have had. But it's also important an opportunity for us to really set a new agenda for the new decade. And this World Report on Vision gives us that opportunity. If you do have the opportunity to browse through the World Report on Vision, they have identified 2 indicators as part of its package of 30 indicators for the universal health coverage. And these 2 indicators, you really have to memorize this. You have to commit to memory. Number 1 is effective coverage of cataract surgery. And number 2, the effective coverage of refractive error services. And if you look at the World Report on Vision, they recommended these 4 recommendation as per list. Firstly, eye care needs to be integrated and they must be a core part of the universal health coverage. Secondly, it recommends that it needs to be implemented as integrated people-centered eye care and as part of a health system. Thirdly, they recommend promoting high quality research into eye care, and obviously, fourthly, this need to be monitored and evaluated. And finally, communities need to be empowered so that they are actually involved in the delivery of eye care services. So, Mr. Fakhruddin, would you like to launch our final slide?
Sure, sure. I'll do that. And just launching one
I
last.
think this is our last slide.
Yeah. Effective refractive error coverage is the new indicator to monitor the progress towards the UHC. So, what's your thoughts on that? All right. Okay. So, I think most of them says true.
Agree. Yeah,
So it's
but there will be one of us who did not say it's true. Well, this is really important, effective refractive error coverage. As an optometrist, I believe we really need to learn how to measure this. And to be honest, we still haven't figured out how to measure and evaluate. I saw a latest paper from London School of Hygiene and Tropical Medicine publishing on this effective refractive error coverage. How do we measure that? And perhaps if we have the time, we should sit together and learn how to measure that. And the one thing that I'm sure how to do that is definitely by means of a study. And the study would definitely going to be by a population based, which is we have to go down to the community to measure. I would like to end my slide here with what are the optometrist role? To be honest, if you ask me, I really don't know how to answer that, because our role, regardless of small or big, is still a role. And I believe each and every one of us have our own role, be it small or big, and it's all equally important. And we have done so much so far, and for WHO to recognize us, to play more role, to play more important role. So it's really open for discussion. And I would like to leave everyone with with this video from Dr. Andreas Müller, for a WHO representative during the E-Asia Optometric Congress on the last 18th of November 2020. So, Fakhruddin, yeah.
In general. At the same time, this is an exciting moment and give opportunity for optometrists to be involved and recognized as key health providers regionally in their countries. So my recommendation to you is to use the World Report on Vision to advocate and to promote your role as health providers in the future. Thank you very much.
Well, so Andres already said thank you. Therefore, I also going to say thank you too. So I leave the presentation back to Mr. Fakhruddin. Thank you.
Thank you so much, Mr. Effendi. So we have got one question is any tips on how can we make people aware about probably I mean this question is directed to eye health services or
Okay.
importance of eye health probably it's in that sense. Any tips on how can we make people aware at the community level?
Oh, this is not an easy question to answer, but try my best. Um, well, when you talk about community, we live in a community, right? In our family first. I guess as an eye care practitioners, what we can do is to disseminate some information on what we are doing at work, what we are supposed to, do, or perhaps the most important thing is vision. If people can understand what the vision, their own vision is, what are their status of the vision? Like for example, people knew what their height and their weight. So from weight and height, you can calculate BMI. So we are, obese or things like that. But people may not be aware of their sight or their vision. So how can we do that in a community level? What we can do is try to help them see in terms of what is their status of vision. How are they going to measure their own vision status? So I'm actually kind of excited to kind of share with you guys about what I've been doing in my community. For instance, where we in my place in Penang, we do have a what we call the blind school called the St. Nicholas Home for Blind School, where we do attend, teach them. Obviously, they are blind, but they do not need to know how to measure their blindness or level of blindness. But what we can do is try to have others surrounding. People in our community could be our parents, our siblings, and even our family members. How to measure, and how to measure it if we do not have a Snelling chart. Therefore, I'm not sure whether everyone knows about the new latest technology like digital health, like they are doing Snelling chart via an Android mobile devices or like Peak Equity, for example. And I do have trained people like normal community pharmacists who came to Penang General Hospital to learn how to do a simple vision testing, using a mobile apps like Peak Equity. I do teach them how to do that. Therefore, if let's say, for example, if they notice people come to their pharmacies and would like to inquire about how to measure their own sight, they can install the apps in their mobile phone and then try to measure that by themselves. So that kind of what we call information, which is really basic. Like for example, we can measure our own height and weight, but how are we going to measure our sight, our vision? So we need to find ways how to um, tell people, tell and instill that kind of um, knowledge and skills. It's simple, but I guess people may benefit from that simple thing that we can do. Yeah.
That's right. Yeah, yeah. The more information we spread across, the more people can benefit and get
Yeah. And
awareness.
especially the thought of covering one eye. People say, okay, if you want to do measurement of vision, we can just use both eye bilaterally, right? So, but it doesn't make sense because we don't know what is the status of the other eye if you cover one. Therefore, there are other public health approach where you cover one eye and try to covering one eye in itself is another technique of teaching community what is their vision status is,
Okay.
right? Covering one eye. That's one.
That's a
There are
very
many.
important
There are
message.
actually
Yeah,
many.
yeah, yeah, yeah.
I
That's
can think of. Yep.
and
Uh,
let's look at the other question. So this is regarding
Shiva,
being an
Shiva.
optometrist, how to improve the health outcomes in terms of the prevention of blindness, and how can we go about increasing the coverage of health services at the government or NGO levels? Any thoughts on this particular aspect, or how can
And also comes into prevention of blindness. when you talk about health outcomes, at the end of the day, we have to measure and evaluate that. And health outcomes in the population level, we are measuring like what are we are doing at the population study, like national eye survey. We went from house to house, measuring people's. Obviously, we have a technique to measure that. And when we measure people's sight and what are their level of sight, and when there we know what are the level of the population in our community. So let's say, for example, in Malaysia, um, 1% or 1 out of 100 Malaysian are blind, and 5.4% or 5 out of 100 Malaysian have some level of low vision. So you know that out of all 100 people that you meet in the community, one of them will be blind, and five of them will have some degree of vision impairment. So from those people, how are we going to increase the coverage in terms of at the government and NGO level? So this is not an easy question to answer, but I guess we need to sit back and look how we're going to improve that service at our own country. Prevention of blindness in itself, you are doing it at day-to-day basis. Whatever you do in our clinic or in our optical shop, when we measure, we evaluate, doing refraction, and those are actually measuring the sight, measuring sight and actually try to improve people health outcome. I guess this is the best that I can answer to
That's
the
right.
best of my knowledge. Yep.
Okay. And one particular question is, what's your thoughts on the importance of research in this background? Any particular
Oh, research.
add-on?
Okay, play in research. Okay, remember that I talked about WHO indicators, the effective refractive error coverage.
Mhm.
So, in order for us to evaluate that, we have to go to the ground. That what we call the population-based study. We definitely have to do that. Without which we won't be able to measure that. Therefore, if you ask me, in terms of prevention of blindness, we cannot run away from going to the ground. We have to help. At least if you do not go down, we have to help others who are going to the ground. Like myself, at that time in 2014, when I go to the ground, knock people's door to ask them to open up, and when we are in our clinic, in our hospital, or in a retail store, we are waiting for people to come. But when we go to the ground, we are approaching people, and they do not want us to be in their house. Sometimes they chasing us around, chase out with dogs all over, and then those are the risks that we have to take. Obviously it's not easy, but what I would like to suggest you, if you want to talk about prevention of blindness, you cannot go without the going to the ground, going out to the community. That's where the prevention of blindness starts. We need to measure what are the prevalence, how many people in the community, our population has blindness, and from there we will start coming with plan of how we're going to tackle that blindness or vision impairment, how we're going to improve our service. For instance, if we sit in our own practice in perhaps in Penang, people are we don't know how many people outside are blind.
That's
How
right.
are you going to help them? We are only focusing in our day-to-day life in our clinic. We do not know what is the real situation outside. Therefore, I believe in terms of research, try to get involved more on what are the community, what are the people needs. We normally in the hospital, we try to look at what can we serve, what can we offer people, but what the community really needs, we don't know.
That's right. Yeah.
Do they really need us, or do they want a spectacle or contact lenses or surgery? You will be surprised that there are people in the community, they are living next to a hospital but they are blind. because they don't know what are the service that we are offering, what we are supposed to do, what are they need to do with their level of sight. In the first place, they don't know what are their level of sight. So I hope that I answering you, Miss Shiva Sigamoni, and the rest. I hope then, and also Zina Shaikh, thank you very much for a good question. So that's my say on this. I hope that I'm able to give some explanation on that.
That's right. I think the most important aspect here is you must be involved in population-based research if you are looking out for research informations and all that. And
Yeah.
really going out into the community helps a
Yeah.
lot, getting out the exact, following the IAPB guidelines and all that. It's really very important.
Yeah, it is. I remember a friend of mine back in London school. His name Dr. Suraj Senjam from New Delhi. He's from the AIMS, I think, Indian all Indian medical school. He was one of the involved with RAB as well in India, and he did mention that RAB is like taking years in India, but we in Malaysia we only managed to settle that in 2 months or 3 months time. But India is such a huge, massive population. They need years to complete that. So anyway, I guess, well, I guess everyone have their own role, regardless how big or how small. You
That's
know.
really true. I think, as you did mention, even in sitting in the optical shop, you are measuring VA and you are actually making sure the refractive correction is given.
Yeah.
So it does not have to be everybody needs to go into the population base.
Yeah, no, you don't have to. Everyone have to go. No, but at least you have the idea that there are people like
Yeah,
us, like people who are going from house to house, knocking people's door and chased by the dogs. We're doing that not because we are doing that because we need to measure. We need to measure what are the level of the society, what are people's side in the ground. We don't know. Without measuring, we don't know what are their level.
yeah.
Yeah.
And knowing all of this again will help people who are sitting there and framing the laws and creating guidelines on how to move
Exactly.
on further.
In fact, we are helping a lot of people in terms of, like, for example, you yourself, Mr. Fakhruddin, you are in the what we call academic. You know how many people that we're gonna teach, how many more optometrists are needed, because that the basic prevalence is a what we call a key words in the community. How many people are blind? How many people needs that services? How many people that we need to cover in terms of cataract surgery and also refractive error? How many people that requires glasses? We don't know. Nobody have that information. Not until we do a proper and thorough population-based study.
That's right. That's right.
Yeah.
Okay, so thank you, Mr. Effendi. I think
You're
really
welcome.
appreciate
You're
your
welcome.
thoughts, your suggestions, and the kind of work which you have been doing. Thank you so much for giving us your time and doing a session for us.
Yes, thank you very much to everyone, each and every one of you. And before I forgot, this is my final word. Be well, do good work, and keep in touch. Bye bye. Take care. Happy New Year.
Thank you so much for that kind words. And you can follow him on social media. And I think he'll be very happy to receive any comments or thoughts or suggestions there as well.
Yes.
Right?
Yes. Thank you. Thank you, Fakhruddin. Thank you, everyone.
Most
Bye
welcome.
bye. Good night.
Yeah. So to the attendees, just for letting you all know, we do have a session tomorrow. This is just a basic of conducting a research in optometry, and this is gonna cover the very basics aspect of how should we go about conducting research and understanding certain aspects of overall research in optometry. It is at the same time as of today, 6:30 late evening Indian time and 9 p.m. late evening Malaysian time. Thank you everyone for attending today's session. I wish to see you all tomorrow as well. Until then, take care, stay safe, and bye bye. Thank you, Mr. Effendi.
Yeah,
Bye.
thank you. Bye bye.